Hi, I'm Dr. Kerry D'Ambrogio, and the purpose of this video clip is to introduce to you the concept of total body balancing. Total body balancing was originally developed by John Wernham, who's an osteopath from Maidstone, England. He was one of my mentors. He was 99 years old, and he was still treating about 8 patients a day. He passed away a few years ago, and his original technique was called the body adjustment. So total body balancing is just how it sounds. It's a full balancing session. We're going to teach you actually how to do a full body evaluation and then a 6-phase treatment routine. In total body balancing, we see the body as a vital mechanism. So what's a vital mechanism? We believe that your body is a living, breathing organism. The cells replicate themselves, every 120 days. So if your body is living and breathing and changing constantly, what does it need? Well, it needs nourishment. Both food, water, oxygen. Well, how does it get to every cell in the body? Through the arterial system. How do we get rid of waste products? Through the venous system and the lymphatic system. And we also need a healthy nervous system. So in total body balancing, we need to evaluate the whole body. We're going to teach you tension tests for all the upper and lower extremities, the spine, the organ systems. We're going to go through range of motion. What we're trying to do is we're trying to find areas where it could affect your vitality. We want to release those areas to create a better sort of environment for healing to take place. After we do this evaluation, we're going to use critical thinking techniques to find out which area we need to work on. Now, in total body balancing, this is classical osteopathy, and we tend to use long levers. A lever could be anything. A lever could be an ankle, right? A lever could be, just the lower leg. The lever could be the whole leg, where I could work this whole leg. And in total body balancing, we use these long levers, and it's very rhythmical. It's very gentle. It's very rhythmical. There's lots of rotation. Typically what we use 3 concepts: the wedge, the lever, and the screw. The wedge is wherever I put my hands. So for example, if I slide my hands underneath into a sacroiliac joint and I come in here to use this lever, the fascia and the muscles from this lever are now affecting exactly where I'm palpating. If I were to palpate over this organ system or her liver or the stomach, I would use this leg, this lever, to affect that area. Okay, so the wedge is where I'm palpating, and the screw is this sort of rotatory movement. So the whole purpose behind these gentle rhythmic motions is that we want to use them throughout the body to stretch out muscles, fascia, joints. We want to release a lot of tension. I can also use a lever in the upper part of the body. I can use the arm, doing some gentle motions like this. I can use some nice levers here to affect the rib cage, okay, as we go through. Now, when we talk about total body balancing, because we're moving the body very gently, it tends to have an effect of settling down the nervous system. It tends to balance the sympathetic and the parasympathetic systems. Total body balancing, like I said before, is a full body evaluation and treatment. It has 2 things that it does. It has a biomechanical influence. So as we tend to do this technique, we are relaxing the joints, the muscles, the fascia. Okay? We're relaxing tension throughout the body biomechanically. In doing so, what we're doing is we're breaking down barriers. Fascial barriers, joint barriers, protective muscle spasm barriers. And when we do that, there's better physiology. So we're going to get better arterial flow, carrying with it oxygen and nutrition, better drainage through the venous system and lymphatic system, better nerve flow. So we create a better environment for healing. So how do we evaluate if somebody needs total body balancing? Well, again, we use subjective evaluation. Did they have a car accident? Did they have surgery? Did they have a fall? What's the mechanism of injury? Okay, what stage of healing are they in? And we also have an objective evaluation, which we talked about in the introductory video. We use the letters ARTS. So the first thing we look at is asymmetry. So I can look at asymmetry anywhere in her body. We're going to teach you to look at, the face, the neck, the whole spine, the shoulders, the upper extremities. We're going to look at the rib cage, the pelvis, the lower extremities. So we look through the whole body. Where is the area of greatest asymmetry? And why is that area asymmetrical? We talked about it in other videos where, let's say, for example, if my shoulder was pulled forwards, why was it pulled forwards? Do I have fascial tension in the front? Do I have weakness at the back? Do I have muscle tension or joint restrictions or swelling? So again, looking at asymmetry is not enough. We got to go to the second letter, which is R. So we begin to evaluate restriction and range of motion. So on this class, we're going to teach you to evaluate all the joints of the lower extremity. We're going to look at the ankle, we're going to look at the knee, we're going to look at the hip joints, okay? We're going to evaluate the wrists, the elbow, the shoulder. We're going to look at the cervical spine, thoracic spine, lumbar spine. We're going to look at the rib cage. So we're going to evaluate range of motion throughout the whole body. What's the nature of the barrier? Is it a hard end feel? Is it a soft end feel? Is it a firm end feel? And we talked about this before. If it's a hard end feel, it's more joint. If it's a soft end feel, it could be more swelling. If it's a firm end feel, then it could be protective muscle spasm if there's a tender point, or more fascial tension if we have a fascial glide. So again, range of motion gives us lots of clues, but again, it's not enough. So we go to the third letter, T. So we're going to teach you tension tests through the whole lower extremities, in the foot, the ankle, in through the tibia-fibula joints, the knee, the hip, the pubic joint, the iliosacral joints. We're going to check the whole spine, cervical, thoracic, lumbar, the rib cage. We're going to go through the upper extremities and in through the cranium. So what we're trying to find is where are these areas, where are these barriers in the body. As we're going through, we could also palpate tenderness, we could also palpate tissue texture changes. The S component of evaluation, special tests, we're going to show you lots of special tests to see if they have restrictions in their pelvis, like a standing forward bending test or a kinetic test, problems in their sacrum. So we're going to show you some orthopedic tests to kind of confirm what's happening. Now, the question you might have is, who would we use this technique on? Typically, when my patients come in who have lots of problems, they've got neck problems, shoulder problems, back problems, they may have had old sports injuries, car accidents, falls, they got multiple areas of dysfunctions. So they need a total body balancing. Just working on one area is not enough, okay? So let's say your patient does come in with all these difficult problems. Total body balancing has 6 phases. We typically start out in this supine position where we're going to teach you to use levers, where we're going to release the ankle, we can release the knee, we can release the SI joint and the pelvic floor, doing nice osteoarticular motions. Then we're going to come up into the upper extremity, release the wrist, the elbow. We're going to come up into the shoulder. We're going to show you lots of different osteoarticular positions for that. We're also going to show you techniques where you can release the rib cage in through there. So we're going to typically work up one side of the body, and then we're going to do the other side of the body, and we can work the neck, and we can also integrate craniosacral therapy or visceral release. Can you lie on your stomach? So on the stomach, we can look at other levers in phase 2 where I can do osteoarticular for the ankle, I can work on the knee, I can work on the SI joint, I can also work on the spine, I can work on the shoulders. Roll on this side and face me. And then we progress into a side lying position. So in this position here, I'm able to work on the spine, I'm able to work on the rib cage in this position, right? Or I can also work on the shoulder in this position. And I'd lie her on the other side. And then as we go through total body balancing, we started her in a supine position, working on the right side, then the left side. We'd go into a prone position, working on the left and the right side. Then we go into side lying on the left and right side. And then we would continue in the sitting position, supine position. You can roll on your back. So we go through all these different phases, and what we're doing is we're evaluating and we're treating using osteoarticular motions. And we can integrate other techniques like muscle energy, fascia release, positional release therapy, visceral release, cranial release, lymphatic drainage techniques. So we can build in all those techniques with this. Now this particular technique, the total body balancing, a full body treatment, this can be done on infants, young children, adults. I've done this on elderly people. Your sports patients are going to love this. I've worked on a lot of my professional athletes. So it doesn't matter if they have acute or chronic sprain or strain, we can work with them because it's very gentle with the body. So at the D'Ambrogio Institute, we're offering total body balancing as 2 3-day courses. The first level, level 1, we're going to teach you a full body evaluation, and we're going to introduce this 6-phase treatment routine. In level 2, we're going to review everything from level 1. We're going to add more evaluation, and we're going to go back to each of the phases, and we're going to add more techniques. But we're also going to show you techniques to deal with difficult cases. What if you have someone who's overweight? What if someone's pregnant? What if you're working with an infant? What if somebody can't lie on their side or their back? What are alternate positions that we can do? So in this class, we're going to teach you general concepts and principles of total body balancing. We're going to review the anatomy and the biomechanics. We're going to go through the arts, the asymmetry, the range of motion, the tension tests, the tissue textures, the tenderness tests, all the special tests. And we're going to teach you each of the 6 phases. There's going to be lots of hands-on in this class. We're going to show you how you can document your results and create a treatment plan. We're going to use lots of critical thinking strategies. And we're going to give you a detailed manual that's going to show you with pictures how to do each of these techniques. And at the end of the class, we're going to be preparing a DVD with a review. So if you want to access that, this will help heighten your learning experience. So we hope to see you at a future course. Thank you.